My name is Adriana Fury, and I'm the creator of Limeade 5K Walk Run in Orlando, Florida.
And I'm Anita Riggs, her #1 fan and mother, and proud supporter of Limeade. We came to this decision to create Limeade one day when Adriana was lying in a recliner at Sunridge Medical Center receiving one of her many treatments that really changed her life. And she said to me, "Mom, can you imagine people who can't afford to do this, how awful it would be that they couldn't receive this treatment?" And that's when we kind of brainstormed and created the idea to send somebody to treatment, which evolved into this beautiful event today.
As some of you may know, about 2 years ago, I was an extremely excited senior heading off to my dream school in Washington, D.C. The entire year leading up to my departure, I had been struggling off and on with mono, Epstein-Barr, and the typical viruses you often hear of at my age. I attributed the unusual symptoms and fatigue to simply overdoing it. Shortly after arriving at school, I made it into my second week of classes, and as hard as I tried, couldn't get out of bed. It was a feeling I can't quite describe, but grew to know it quite well in the coming year. My gut instinct knew this wasn't just Epstein-Barr running its course, and after 5 very long weeks, with the help of my relentless medical entourage, we pinpointed the culprit to be Lyme disease, along with the common co-infection Bartonella and Babesia, parasites of the red blood cell.
Christmas Eve of this past year was one of the worst days of my life in terms of watching my daughter suffer and being yet again a year later still struggling with such profound symptoms, neurotoxic, and every system and organ in her body not functioning well. I had the good fortune of speaking to Gio on Christmas Eve and literally hung up my call with him dancing in my kitchen. I had a big long list of questions for him. I had done my research, having run a hospital here in Orlando for many years and having lots of different physicians that I dealt with in the traditional medical community. I wanted to come armed with questions. First, I finally met somebody that talks faster and more than I do in Dr. Franco, and it was a pleasure how quickly he processes and how brilliant he is. Obviously, in one quick phone call, I knew whom I was dealing with. It was a very gifted provider and just a compassionate, genuine man. But he answered my questions before I even asked them. Just intuitive and wise and brilliant and kind. And I had tears when I hung up the phone, and I was dancing. I was so super excited to run upstairs and tell Adriana about this resource, and literally said, "We are going. As soon as this holiday season is finished, we are going in the beginning of January, because I'm crystal clear this guy not only knows what he's talking about, but he's going to get you well." And once we got to Arizona, we were received with incredible warmth, compassion. The staff is incredible. The setting is really serene and zen-like, and that's a big compliment coming from me. I need that energy. I love that energy, and it is warm and inviting and beautiful there. But Dr. Franco actually spends time with his patients, which is so unusual. We spent many hours talking, asking questions, trying to understand, and just resource for when she returned home here to Florida. My only request is that he open a center here in Florida. And I've told him, "Why aren't you in the Southeast? We need you here." But even being back in Florida, we've been able to call him endlessly and text him with questions, because all kinds of little things come up now that we're managing the treatment back here at home, and we need his guidance, we need his wisdom, we need his superior knowledge, and he's just an amazing man. Adriana was in bed from September 2nd until Christmas, the first year of her suffering, and I couldn't imagine that my beautiful college girl was laying in her bed, unable to tolerate sound, light, touch, and what a horrific suffering it was for those first couple of months. She finally worked her way back to moving slowly and beginning to exercise and beginning to plug back into work and life and hope that she could return to school. She did return to school the second year into her disease process and made it a couple of months at Georgetown University, and again needed to come home having a major reactivation of symptoms. And at that time she needed to use a wheelchair. In fact, when we came out to Arizona, she was in a wheelchair, and the most amazing evolution occurred while we were there. Actually, one morning I heard her rustling around at 7 o'clock in the morning, and she's not an early bird, and I walked in to see what was going on with her, and she was smiling. She had the most amazing, beautiful smile, which is also unusual first thing in the morning for her. And I said, "Adriana, you're scaring me." and she said, "I forgot what it feels like to feel well." And it made me cry, needless to say, that I saw that sparkle again. And when she left Arizona, she snuck out there and climbed a little mountain before she came home to our flat Florida. It was really cool.
My goal was to climb Camelback, and we didn't do Camelback, but we did Sunrise, I believe,
yeah.
And it was a great, on the day I left Arizona, we did Sunrise that morning, so it was a good accomplishment, and Geo definitely got me back to being able to do that. Our goal is to spread awareness, and if by telling my story does so, I tell it 1,000 times over again. The money raised today and over the past few months will go towards a Lyme AIDS scholarship. The generosity I received is indescribable, and my hope is to continue to pay that forward.
I can't say enough about how many people have contacted us. Just hearing Adriana's story, we've had emails and phone calls and requests and text messages from all over the country of people wanting to learn from her experience. And that is certainly the most important part of Lyme Aid as far as I'm concerned. It's offering those people who are in the depths of suffering that there is hope to feel better, that they don't have to stay feeling so awful and they're not alone in that experience. One of the many, many days that Adriana was lying in her bed in the dark, unable to have noise or light, I started crying this one particular day. Most of the time I tried to not show her my tears, and that day I said to her, "Please do not mistake my tears for weakness. I just can't stand seeing you suffer like this, but know that we are way more powerful than Lyme. And when I look at this crowd, I am absolutely certain that we are way more powerful than Lyme."